Bismillahirrahmanirrahim. Hello friends. Today we will discuss the next portion of the classification of gingival and periodontal disease and condition affecting the periodontiums. We will discuss here non-plaque induced gingival lesions. As the heading suggests that the gingival lesions which are not induced by plaque are listed below. Number 1, we have gingival disease of specific bacterial origins like Neisseria gonorrhea, Treponema pallidum, syphilis, Streptococcus species, and other species. And number 2, we have gingival disease of viral origins like herpes virus infections, primary herpetic gingivostomatitis, recurrent oral herpes, varicella zoster virus, and other viral origins. Gingival disease of fungal origins relatively uncommon in immunocompetent individual, as the human being have immune systems. If the immune system is well enough, so there is no chances of fungal infections. If the immune system suppressed due to any cause, so the fungal infection chances are high. And those with normal flora distributed by the long-term use of broad-spectrum antibiotics. Candida species infection, generalized gingival candidiasis, which may be linear gingivoerythema, histoplasmosis, and other fungal gingival disease. Gingival lesions of genetic origins, we have hereditary gingival fibromatosis. Gingival manifestations of the systemic conditions like mucocutaneous lesions like lichen planus, pemphigoid, pemphigus vulgaris, erythema multiforme, lupus erythematosus, drug-induced or other. B. Allergic reactions. Dental restorative materials. There are certain substances in the dental restorative materials which are allergic materials which may cause allergic reactions like mercury, nickels, acrylics, or other substance of the restorative materials. This is not that every persons have allergic to the restorative material components. There are some peoples who are allergic to their components. Reaction attributed to the toothpaste, dentifrice, mouth rinses or mouthwashes, chewing gum additives. Traumatic lesions like factitious, iatrogenic, accidental, which may be chemical injury, physical injury, or thermal injury. Foreign body reactions like lead to localized inflamed conditions of the gingiva are caused to introduce the foreign material into the gingival connective tissue through break in the epithelium. Introduction of amalgam into gingiva during placement of the restorative or extraction of the tooth, leaving an amalgam tattoo or abrasive during polishing procedures. Classification of various forms of periodontitis. In 1998, we have form of periodontitis are adult periodontitis, early onset periodontitis, periodontitis associated with systematic disease, and necrotizing ulcerative periodontitis, refractory periodontitis. European Workshop 1993, we have adult periodontitis, early onset periodontitis, necrotizing periodontitis. International Workshop in 1999, we have chronic periodontitis, aggressive periodontitis, periodontitis of manifestation of the systemic disease. Periodontitis. It is defined as an inflammatory disease of supporting tissue of the teeth caused by a specific microorganism or a group of microorganisms, resulting in progressive destruction of periodontal ligaments, alveolar bones with pocket formations, recessions, or both. The disease periodontitis can be subclassified into the following three major types: clinical, radiographical, historical, and laboratory characteristics. Chronic periodontitis, prevalent in the adults but can occur in children's. Amount of the destruction can consistent with local factor associated with variable microbial pattern. Subgingival calculus frequently found. Slow to moderate rate of progression with possible period of rapid progression, possibly modified by or associated with following systemic disease such as diabetes mellitus and HIV infections. Local factor predisposing to the periodontitis, environmental factors such as cigarette smoking and emotional stress. Chronic periodontitis is further subclassified in the form of two types, localized form or generalized form. If the area of the periodontitis is less than 30%, so the chronic periodontitis is classified as a local form. If the area of the involved site is greater than 30%, so this is called or classified as a generalized form. And we have categorized the severity of the chronic periodontitis as mild, moderate, severe. In mild, we have 1 to 2 millimeters of the clinical attachment loss. We call it CAL. Moderate, we have 3 to 4 millimeters of clinical attachment loss. And severe, we have greater than 5 millimeters of clinical attachment loss. Aggressive periodontitis, clinically healthy patients, rapid attachment loss and bone destructions, amount of the microbial deposit inconsistent with the disease severity, familial aggregations of disease individual, disease site, infection with ectobacillus, abnormalities in phagocyte functions, hyperresponsiveness, responsive macrophages producing increased prostaglandin E2 and interleukin 1 beta, in some cases self-arresting disease progressions. Periodontitis is a manifestation of the systemic disease. Periodontitis may be observed as a manifestation of the following systemic disease like hematological disorders, acquired neutropenia, leukemia, genetic disorder, familial or cyclic neutropenia, Down syndrome, leukocyte addition deficiency, and there is a list of the diseases which can cause gingival disease, periodontitis. Necrotizing ulcerative periodontal disease. We have necroting or necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis, clinical attachment loss and bone loss occur. As the main difference between gingivitis and periodontitis is that there is the pocket formations and the bone resorptions. Abscess of periodontium, we have gingival abscess, we have periodontal abscess, we have pericoronal abscess. Periodontitis associated with endodontic lesions, endodontic periodontal lesions, pulpal necrosis, proceed periodontal changes, periodontal endodontic lesions, periodontal pocket associated with attachment loss, and root exposure may spread through accessory canals to the pulp, resulting pulpal necrosis, combined lesions. And we have another form of there is endodontic plus periodontal endodontic lesions occur. Developmental or acquired deformities and conditions like localized tooth-related factors that modify or predispose to plaque-induced gingival disease or periodontitis. Tooth anatomic factors, malformations of the tooth develop or tooth locations, dental restorative or appliances, root fractures, cervical root resorptions. Mucogingival deformities and condition or edentulous ridges can also proceed to the periodontitis. There is a list of the deformities. Mucogingival deformities and condition on it angulus ridges, vertical or horizontal ridge deficiency, lack of gingiva or keratinized tissue, gingiva, gingival or soft tissue enlargement, aberrant frenums of the muscles position, decreased vestibular depth. Occlusal trauma, there is primary occlusal trauma or secondary occlusal trauma. Thank you very much.